please bring them on in. Perfect. Thank you so much, Sandra. Yes. Perfect. Hello there. Welcome to Wing A, Room 3. Yes, this is the nurse wing. I am Nurse Moon. It's a pleasure to meet you. Yeah. And I know it's a bit of a rough time having your bed wheeled around the hospital, but how are you doing? Good. So, dear, I'm just going to check you in. And today you have a general checkup and a muscular checkup, especially after the accident that you were in. Good. So, my dear, on your wrist you have a patient ID number. Do you think you could read it off to me? Yeah. So it's 24601. Perfect. And could I get your name and birthday? Thank you. It's just a double check to see if you're okay. Perfect. We are all signed in now. And the first question is, how are you doing? A little out of it, a bit of vertigo. Yeah, I do see you have a bit of lacerations as well, so I'm going to take care of that today. Got a bit of hand sanitizer here. Anywho, welcome to the nurse wing of the hospital, where we watch over you during the night, especially when you're asleep, to make sure that you're okay. Good. And first, I'm just going to grab your vitals if you'd allow me to. Perfect. Gonna quickly get your heartbeat. Good. So, just sit still and relax, okay? Good. The other side. Good. And now just to the center. Let's just see here. Very good. So, your vitals were good, heart rate a bit elevated, but that's normal, especially due to the morphine. So, I'm just going to write that down. And could you please give me a hand? I'm going to just take your blood pressure through a little machine that we put on the finger. Thank you. So just going to just sit there, okay? Good. So, the blood pressure was perfect for the patient. Lovely. Perfect. I'm now going to do a quick eye exam with the light, and just going to look into your eyes really quick. 4 quick flashes. Just look at me, okay? Just keep your eyes on my eyes. So 3 and 4. That eye properly dilated. Perfect. Now the other one. 1, 2, 3, feel any vertigo at all from doing that? A bit more dizzy, I understand. I'm going to note that, especially after an accident where you do have a bit of a shake to the head. It can cause a bit more vertigo than usual, often known as whiplash. So what I'm now going to do is, if you could please just follow the light for me. Yes, and please just try not to move your head while we do so. Just with your eyes, okay? Okay, so far so good. I'm watching. Okay. And wonderful. Now follow the light as I move it from the floor to the ceiling, okay? Please try not to move your chin or your head while I do so. This is to quickly assess your orbital nerve. Okay, so ability to follow light without moving head 50-50. And again, this could be because of the vertigo and often the case of accidental problems. So next I'm going to do a quick orbital eye exam, okay? And going to just focus on each eye. And if you could please just follow the light without moving your head with this particular eye, okay? Just follow it very carefully. And just please try not to move your chin. Okay. Wonderful. Now, just quickly from left to right. And now quickly up from the ceiling and to the floor. Okay. So it appears that this eye is working properly. That's good. Okay. Now the other one. Just quickly follow the light. Okay. Very carefully I'm going to draw the light into a shape and just follow it. Okay. Okay, that was perfect. Now, from each direction, just going to look at. Please try not to move your chin. Thank you. This will help me better assess if there happens to be a nerve problem. Typically, optic nerve is one of the most that can get a bit fluctuated, especially after trauma. Okay, so fluctuation with eyesight between eyes, that's okay, don't worry. And actually very good motor function from each angle, just a bit of fluctuation. Okay, now gonna get a little tongue depressor here. May I just have a quick look? Thank you. Just going to quickly shine and take a quick look. If you could just go thank you. That helps. I see no damage with the area. Perfect. Thank you, by the way. So, eye examination to do something called muscular assessment. It's going to involve face touching, shoulder touching, and then I have this tool here, and we gently tap on the sides of muscles to see if they have a reflex, okay? Okay. And first, what we're going to do is I'm just going to gently press around the nerves around your face. Typically, these would be known as cranial nerves as well as facial nerves. So, we're going to start off at the temple, at the forehead, and then move down under the eyes, and I'm going to look for reaction and fluctuation with muscles, okay? Good. So, just going to quickly, just gently feel the muscles around the face. Are you okay? Okay. Everything will be okay. You will feel better soon. And everything will feel okay. I promise you. You're also under the care of the best doctor and best nurse here at this hospital, so just going to gently feel now under the eyes. If you could please close your eyes as tightly as possible. Thank you. I'm also looking for similarities between the muscles, so this is the perfect time to assess for that. Okay, now to the underneath parts of the cheekbones here. Everything will be okay. I'm also going to avoid the very slight injuries that are to your face. We will clean them up afterwards with a very gentle cleanser and antibiotic. So, if you could please, could you stretch your mouth out just a bit? Just going to see if the muscles are very, very similar. Okay. Okay. Now we're going to do just gentle pressing around the face. So. Okay. Okay. So, facial assessment was got muscles working properly and muscular nerves working perfect. Now, I'm going to press behind the backs of your ears. This may cause vertigo, but it's to also assess to see if you can, number one, have feeling behind the ear, and it could also help us assert another nerve for the connection of the cranial nerves. So, okay. Okay, and do you feel any bit more of a vertigo or an unbalance? A little bit, okay. So that's very good to know. Thank you. I do apologize for the inconvenience of it feeling a bit uncomfortable, but it's good to know. Okay. Next, a bit of a hearing exam. If you could just close your eyes for me. I'm going to make noise and you let me know which side you hear it on. Just raise your hand a bit, okay? Thank you. So just close your eyes, okay? And just going to. Good. Good. Hearing assessment okay. And sensitivity to hearing also okay. Thank you. Now what I'm going to do is I have to give you a bit of a medicine for the inflammation. Then we're going to clean your wounds with 3 different types of cleansers. So, as prescribed by the doctor, you're going to need about 8 drops of this right under the tongue. So please, 1, 2, 3, 4, 5, 6, 7, 8. Perfect. Okay. And I know it tastes like bubble gum. It's quite nice. Medicine administered. And now what we're going to do is first spray a general topical ointment, and then we're going to apply specialized ointments for the different types of lacerations that you see on the face. So I'm just going to spray this a bit, and then we're going to gently pat it in. So a bit of a medical grade spray. So now a bit on the cloth there. And we're just going to gently just swipe that on, okay? So okay. Perfect. Now, this first one is for the areas that are a bit like a swollen area with sandalwood in it, so it's perfect. So, going to get grabbing a little Q-tip. You were just going to grab a bit of this, and we're just going to get a small amount of it onto the cotton. We're just going to gently, just going to scoop just a little bit onto this area. Just making sure to get the coverage perfect. So just making sure to just gently get the coverage. This too bad. So I'm just going to make sure that it's onto the other side now. So I'm just going to protect just a bit. Perfect. Now this is good. Just going to make sure that this magic is working just gently as this is perfect. Okay. This next one is for around the part of the nose. It is eucalyptus. Oh, it smells amazing. So I'm just going to grab a bit of that there. This is to make sure the sinuses are open. Okay. Just going to just very gently, just going to just swipe that, making sure it gets around. Now the hospital doesn't smell the best, so it's perfect. So I'm just going to apply this just around the wrist. I'm going to fix my eyes. And one more. This one is based off of lavender, and it's perfect just for around the eye area. Grab a bit of that and get a little around here. Grab just a bit from the tip. This will also help with the woozy feeling. So just stamp that on. Perfect. Now I'm going to take a quicker look. And I'm going to quickly grab my pen light once more. And around the face, it does look like the swelling has gone down a bit. How's the vertigo doing? Okay. Good to know. I'm going to take a quick closer look here. Just a bit to see how everything is going. Looks like it's going well, which is wonderful. Good. Looks like you're all set. Going to write that down, that everything was done in consecutive order and that you're feeling a bit better than before, but to watch out for the vertigo. Thank you so much. I'm going to clean all this stuff up, and we are going to watch you for the evening to make sure that your health is good, and to make sure that you're just recovering, especially after the incident. So thank you so much for being so patient. Now I'm just going to clean up around here, sign you off, and you have yourself a wonderful good night.